Welcome, everyone, to today's webinar, From Frameworks to Groundwork, Reframing Aging in Colorado and Maine. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change this selection, you can do so by accessing your audio pane in the control panel to the right of your screen. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. I would now like to introduce John Feather, CEO of Grantmakers and Aging and moderator for today's webinar. John, the floor is yours.
Well, thank you so much, Joy, and thanks to all of you who have joined us today. We want to particularly thank the Hartford Foundation of New York for their continuing support of our monthly webinar series, which allows us to bring this presentation to you free of charge. How can we collectively change the way Americans think about aging? In 2015, Grantmakers and Aging partnered with 7 other national aging-focused organizations to address this question. With the support of visionary funders and working with the MacArthur Foundation award-winning FrameWorks Institute, we released a major report to drive a productive narrative on aging issues called Finding the Frame, an empirical approach to reframing aging and ageism. Since the start of that initiative, several GIA members and national aging organizations have adopted the research of reframing aging and are working to spread the recommendations of the research to their grantees and to the greater public. 2 states, Colorado and Maine, have been particularly impactful. They presented their presentations at our annual conference last year to a packed room, and we knew this would be a topic we wanted to continue to share broadly with both the funder audience and our broader aging audience, who we're also reaching with this webinar. Joining us today, Ruta Kadonoff is the Senior Program Officer with the Maine Health Access Foundation. Laura Lee is the Senior Program Officer at the Maine Community Foundation and leads their foundation's strategic initiative on aging. Therese Ellery is the Senior Program Officer at the Rose Community Foundation, and she also oversees the foundation's aging program area. And Janine Vanderburg is the Initiative Manager for Changing the Narrative in Colorado and a Certified Master Trainer for Reframing Aging. We want to welcome all of you. As was mentioned earlier, you will have the opportunity to ask questions of our panelists as we end the presentation today. Please go ahead and open the question box you see on the right hand of your control panel. If you open the question box and type in your questions at any time, we will be addressing those at the end. So Ruta and Laura, let's start with the work in Maine and the great things that you have been up to. Tell us a little bit about that.
Well, thank you, John, and good afternoon. I'm Ruta Kadonoff, and I'm with the Maine Health Access Foundation, and as John said, I'm joined by my colleague, Laura Lee, who's with the Maine Community Foundation. Next slide, please. This slide provides you with a little bit of general context about who we are and the fact that while both of our foundations have broad missions, as we also highlight here, each of our organizations has also explicitly identified the needs of older people as one of our strategic focus areas. Next slide, please. As John noted, this work was developed in response to the recognition that changing the conversation about aging is important for a whole host of reasons. The impacts of ageism on society are truly pervasive. One major consequence is discrimination in the workplace. Older workers experience greater difficulty being hired and remain unemployed longer when they lose their jobs, resulting in significant economic pressure as well as limiting their ability to contribute within their communities and professions. Perhaps most importantly, though, is the impact of ageist biases on public policy. We know from our work with the FrameWorks Institute that the way we talk about issues shapes the way we and others think about issues, and hence the degree of support we experience for public policies we and our partners seek to advance. Next slide, please. More specifically for my organization, though, which is focused on health and healthcare, there is concrete evidence of the impact of ageism on the health and well-being of older people. I've provided a link on this slide to the American Society for Aging blog post, which in turn links to the full special issue of the Generations Journal that details the research I'm going to only very briefly summarize. In short, numerous studies show that tackling ageism among healthcare providers is critical to improving the health and well-being of older people. Dangerous consequences that flow from negative stereotypes include clinicians attributing symptoms to normal aging and hence failing to appropriately diagnose and treat reversible health conditions. This includes pain, fatigue, cognitive impairment, depression, anxiety, and others. On the flip side, overtreatment can result from a lack of knowledge about how health recommendations should be applied for older people and may need to be adjusted for this population. With regard to communication, studies rate doctors as less patient, less engaged, and less egalitarian with older patients. And older patients often encounter healthcare providers who automatically shout or raise their voices when communicating, or worse, ignore them altogether and speak to a younger person who accompanied them to the visit. Older people surveyed described providers who assumed they could not hear well or could not understand, and 39% felt they were patronized or talked down to. And last but not least, these beliefs lead to systemic challenges for the healthcare system, including difficulty recruiting providers to geriatric specialties and limited research on older populations, which perpetuates a lack of evidence base for best clinical practice specific to older people. Next slide, please. Beyond health care, however, and perhaps even more troubling, the literature also demonstrates the impact of older people's own beliefs about aging and how they translate into behavior and outcomes. For example, older adults who believe pain, fatigue, depressed mood, dependence upon others, and decreased libido are a normal part of aging are less likely to seek health care, increasing that risk I mentioned previously for undertreatment. Those with low expectations for aging are less likely to engage in physical activity and other preventive health behaviors. And perhaps most troubling of all, older persons with positive age stereotypes were 44% more likely to fully recover from a severe injury or disability than those with negative age stereotypes, and older individuals who held more optimistic views of aging lived on average 7.5 years longer than those with less positive perceptions of aging. So fundamentally, the way we view aging has a very real impact on our health. So for each of our regional partners, we all brought our own priorities and goals to this collective work. But for MHAF as a health foundation, it was that health connection and the clear link to our priorities that engaged us. Next slide, please. So why Maine? Well, this headline and photograph come directly from one of our major daily newspapers just a few months ago. And this is the simplest reason why Maine is a place where this work is particularly relevant and timely. Next slide, please. This is just a really brief outline of the rest of what Laura and I will cover for you today to provide a picture of what we've been doing and where we're headed moving forward. Next slide, please. Our goal is very simple. It's to change the conversation to build support for policies and practice. As we learned about the resource that had been created by the FrameWorks Institute, we began talking about the possibilities for bringing it to Maine, and in some sense as a pilot for what might be possible if a multi-funder partnership focused on changing the narrative on a statewide level by engaging key leaders across sectors. Next slide, please. These are the funding partners that collaborated on this work, and I would be remiss if I didn't explicitly acknowledge Laura's leadership role. MHAF is but one of the partners, but the lead role and the lead funder has been Maine Community Foundation. You'll also note several partners from New Hampshire in addition to Maine. Because we here in northern New England share many similarities, we often seek to support one another and work regionally. So several of our colleagues in New Hampshire expressed interest in joining us on this journey and brought participants to the learning events in Maine. Next slide, please. So here's what we've done thus far. We engaged the FrameWorks Institute in a 2-year contract to work directly with our learning collaborative. We introduced the work at the annual convening of the Maine Council on Aging, known as the Wisdom Summit, in 2017, with plenary and workshop sessions that were presented by FrameWorks Institute. We identified over 60 leaders from across sectors to participate in the first phase of training, 2 two-day Frame Labs, which are intensive learning and training in the FrameWorks approach. Maine Community Foundation offered mini grants to support reframing of materials for things like redesign or reprinting, and we recruited 12 participants for a second phase of training that took place this past fall, focused on developing a group we termed peer facilitators who have committed to spreading their knowledge and expanding adoption of the reframing aging narratives. This group of people is now among those nationwide with the most direct hands-on training time with FrameWorks Institute experts in the implementation of both the Reframing Aging and Reframing Elder Abuse tools. We've also engaged FrameWorks Institute to join monthly calls to provide refresher content and address questions. Next slide, please. So what's next? Well, those peer facilitators have committed to sharing their learning with others through presentations in their organizations and networks and voluntary completion of frame checks for colleagues looking to improve their communications materials. And we're currently working with that group to define our future work together as a community of practice, how we will support one another in continued learning and application of the reframing tools, as well as seeking to coordinate strategy around outreach and communications on a statewide level to try to maximize reach and impact. And with that, I'll turn it over to Laura.
Thank you, Ruta. Good afternoon, everyone. When approaching how we were going to bring reframing aging to the ground in Maine, we wanted to have an evidence-based method to help guide us in our work, to give us a way to understand and think about what we were doing. One of our evaluators, Mary Lou Cialfi, who is now affiliated with the University of New England, led us to the diffusion of innovation theory, and we have been using it as a strategic guide. The definition you see here is from Everett Rogers, who wrote the Bible of Diffusion Theory, a thick black book aptly called Diffusion of Innovations. Broadly speaking, diffusion theory is about getting new ideas to grow. And by new ideas, I mean anything new products, new processes, and of course, as in our case, the reframed aging narratives and frame elements. Our question and hope is, if we use diffusion theory concepts, can we get faster growth of reframing aging? We know from diffusion theory that innovations generally spread from higher levels of the social system down to lower levels. Therefore, leaders with credibility within a social system will be the primary carriers of the innovation message if it is to grow and spread within that system. Social system is a relative term, and there are many systems within systems. Our container is Maine, but we also consider that there are social systems within each industry or sector, and that each organization can be its own discrete social system. We used Malcolm Gladwell's descriptions of the types of people who are essential in spreading new ideas when thinking about who to recruit to attend the Frame Lab that Ruta mentioned. In his book, The Tipping Point, Gladwell discusses connectors, mavens, and salespeople. Connectors are know everyone in the social system and want to connect people. Mavens study things deeply, and they know a lot about many things. They are the people that we go to for information. Salespeople are persuaders who are charismatic and have excellent negotiating skills. Something about them makes people want to agree with them. We had a nomination process that asked people to identify individuals who had these types of traits. We also had an application and developed a scorecard to aid us in identifying individuals high in their social system, for example, their organization or sector, and who also might fit Gladwell's archetypes. We also look for diverse representation across sectors within the field of aging, as well as geographic spread, which is important in a large state like Maine. Next slide, please. Another way that we've used diffusion theory is to include a module about it in the Frame Lab curriculum. This was so that participants could also be using diffusion theory concepts when thinking about the choices they made when presenting to an audience, and also so that they could understand their role as early adopters. In this graph, you see the diffusion S-curve. The vertical y-axis is the percent of people who have adopted the innovation, and the horizontal x-axis is time. If an innovation is going to diffuse fully, it has to eventually reach Gladwell's tipping point, or what Rogers referred to as reaching critical mass, which he estimated to be around a 20 to 25% adoption rate. It is at that point that an innovation is self-sustaining. It will continue to grow and gain momentum without added input from others. Under the S-curve, you can see the bell curve of adoption. Rogers determined that about 2.5% of people are innovators, and about 13.5% of folks are early adopters. These include our few, or Gladwell's, connectors, mavens, and salespeople who have attended our Frame Lab. To emphasize the importance of reaching the tipping point, note that some researchers have identified what's called the chasm between the early adopters and the early majority on the diffusion bell curve. This is the place where innovations either reach that critical mass, move up the bell curve, and are sustained, or they don't, and they either disappear entirely, or they just remain at an unsatisfyingly low level of adoption until circumstances shift. And obviously, we don't want the latter to happen. So we are seeing our work. It's getting more early adopters and early majority folks on board to push us up the curve to the tipping point. And we're thinking about this in the context of a variety of social systems. When we think about our target audiences, keep in mind whether they are typically risk takers, leaders, whether they are resourceful and have resources, courageous, assertive, enthusiastic, principled. These are the qualities of the early adopters. It may be hard to know these things about our future audiences, but thinking strategically about our audiences may help get faster and broader adoption of our reframed messages. Next slide, please. This checklist includes some of the ways that we're using diffusion theory to think about how to facilitate the spread of the new narratives and frame elements. Rogers determined that there are 5 attributes of an innovation that matter, or that influence whether and how fast it spreads or grows. First is relative advantage. This is about how will I benefit? Is it worth it to do the work of reframing, investing the resources of time, money, and staff? Next, compatibility. Compatibility can be with any number of things. Is it compatible with your values, your workflow, your organizational hierarchies, your belief systems, etc.? Third, complexity. The simpler an innovation is, the more quickly it will spread. Complexity tends to slow things down. Fourth is trialability. How easily can the innovation be tried out? And lastly, observability. The easier it is to see, the more quickly an innovation will be adopted. In our post-Frame Lab survey, we looked at participants' perception of the frame elements through the lens of these 5 attributes of an innovation. Next slide, please. We found that participants saw clear benefits for the field and for their own work. They also saw the frame elements as the best available tools for shaping the conversation on aging. Issues that could slow diffusion included the complexity. It's not necessarily easy to do. Compatibility issues. While individuals found it compatible with their own views, some saw it as incompatible with their organization's current communications. And some found it hard to know how to go about trying it out. Next slide, please. We were also interested in whether or not participants were using the frame elements in their own communications, as well as making changes to their organization's communications. Within a month, participants on average agreed or strongly agreed they were incorporating frame elements into their own communications and those of their organization, as well as sharing frame elements with colleagues and friends. Examples of organizational communications included selective use of frame elements in websites, brochures, funding applications, social media, newspaper articles, briefs, presentations, talking points, and mission statements. We also asked people to self-identify in relation to Gladwell's archetypes and found that greater identification as a connector had a slight to moderate association with incorporating frame elements into personal and organizational communications and sharing with colleagues. Next slide, please. We found a wide range of perceived barriers, but the most common ones were related to confidence level in using the frame elements correctly, the time and effort involved, and addressing skepticism among stakeholders. As mentioned, we did offer additional peer facilitation or train-the-trainer type training to a subset of Frame Lab participants, and they have reported an improvement in skills and confidence with using the frame elements. So this was one way that we tried to address that first barrier. Next slide, please. So, what did we learn? There's a lot of interest and enthusiasm for taking this on. Participants have appreciated the learning and time to make connections across the field. One participant told me that the effort itself made her feel that her work was being valued. Of course, credible influencers are busy people. And this is definitely a challenge when reframing takes time and is not necessarily easy to do. The Frame Lab or any one training is not enough. Providing ongoing learning and encouraging practice is important to developing capacity and sustaining interest. Next slide, please. From our perspective as funders, it's been a reaffirmation of the value of relationships and partnerships. We couldn't have done this alone, and we're able to build on existing relationships. For example, many of us were already co-funding the Tri-State Learning Collaborative on Aging together. Having different partners also increased the diversity of the cohort as we were able to draw from multiple networks. As the lead funder, it has been helpful and enriching to have a group of advisors to turn to for help with the selection process or for feedback on mini-grant applications and more. It's also been great to partner across state lines with Endowment for Health. Kelly LaFlamme has been a wonderful thought partner, and it's been extremely helpful to compare notes with a similar but different context. And I know at least one or two of the funding partners has expressed that it's been great to benefit from the partnership, but not necessarily have to take on the workload of the lead role. Lastly, ultimately, what we are talking about here is massive cultural change. This is tough, slow work, but also very exciting and well worth the effort. Thank you so much for listening, and we will now turn it over to our colleagues in Colorado.
Thank you, Laura. This is Therese, Ellery, and there we go, next slide. Thank you. I first want to thank the John A. Hartford Foundation for sponsoring today's conversation with GIA, and also I want to thank John and Emily with GIA for their opportunity to share our story today. I wanted to give a little background about Rose Community Foundation and why we launched Changing the Narrative, and then I'll turn it over to Janine to really get into the elements of our Changing the Narrative work. So first of all, Rose Community Foundation was created in Denver, Colorado in 1995 with the sale of Rose Medical Center, a Jewish hospital that served the Denver community. The foundation's mission is to improve the quality of life in the greater Denver area, which for us is the 7 counties in and around the metro Denver area, and it includes Boulder. We fund in 5 program areas: aging, child and family development, education, health, and Jewish life. We also administer advised funds because we are a community foundation and have a philanthropic service area as well. The foundation distributes about $9 million annually. I'm really proud to work for Rose because we were the first foundation in the region to have a standalone aging program area. Within the aging program area, we fund direct, responsive grants. We respond to the community and people can apply at any time within the 7-county area. And we fund basically in-home direct services and safety net services, things like home delivered meals, transportation, home remodification, things like that. Our other part of our grant making are our initiatives, including Boomers Leading Change and our Latino Age Wave initiative, and those would be saved for another webinar. But now our new initiative is Changing the Narrative. Each of these initiatives is focusing on an asset-based approach to aging with the goal of shifting the perception of aging to be a more positive one. So Changing the Narrative really is a natural extension of our earlier work. Rose invested in the original FrameWorks Institute Reframing Aging research, and we were fortunate enough to be able to send Janine to become a certified Reframing Aging trainer. The Changing the Narrative initiative was actually launched last year, so we're entering our 2nd year, and we're so excited to have the Next 50 initiative partner with Rose, allowing us really to ramp up quickly and expand the initiative across the entire state of Colorado. Next 50 initiative, if you don't know, is a new foundation in aging that focuses on improving and sustaining the quality of life for people in the second 50 years of their life. We are excited that its president and CEO, Margaret Frankhauser, was already familiar with the Reframing Aging research and messaging. We specifically designed this initiative to be a 3-year, multi-year effort. We wanted to have a person that was focused solely on this, so we hired Janine to have this be her project. And we also designed the campaign to have Reframing Aging training as only one element of our campaign. Our goal here is to end ageism together in Colorado. With that, next slide, please. I'm going to turn it over to Janine.
Thanks, Therese.
Hi everyone. What we're going to cover in our presentation, first I'll talk a little bit about our overall initiative because as Therese mentioned, reframing aging itself is one component of it, and I'll include kind of what our theory of change, our audiences that we were trying to reach, specifically the initiative elements. And if anyone is interested in learning more about the overall initiative, either Therese or I are happy to chat with you at any time after the webinar. But we're going to do a brief overview so you can see where reframing aging fits in. Then we know that you're here to hear about reframing aging. So we'll talk about what we are doing in that space. And finally conclude with kind of what we got done in 2018. It was a busy year, and lessons learned, but specifically, again, around reframing aging. Next slide. So, like our colleagues in Maine, we also had a theory of change, and it basically kind of looked like this. We too are trying to change basically policies and practices and funding to reflect what's needed in a society where demographics have fundamentally changed. And if we start at the left-hand side, part of our theory of change was first we had to increase knowledge and understanding in specific kind of changes, and knowledge and understanding that we were seeking to change were first and foremost, increased understanding that, not only is our state, but the U.S., the world has changed. We've got the fundamental demographic shift of an aging society. Increased knowledge of ageism, the fact that it exists, and you've heard certainly some of the detrimental effects from our colleagues from Maine, but really letting people know about that. Of the value and contributions that older adults can make if we don't allow ageism to get away. Certainly, and the reason that reframing aging is a part of it is letting people know what are effective messages and communications that shift that public understanding. And finally, that policy change and innovation can occur, need to occur, and can make a difference. So that's kind of the knowledge and understanding that we're seeking to change, hoping that that would lead to changed attitudes and beliefs about aging and ageism, having people have more accurate and positive attitudes about aging and about older people, having people understand that ageism can and should be dealt with, and that a collective and public policy response is not only needed, but actually desirable. And so collectively, our hope is that long-term will lead to those change policies that will reflect that we are actually addressing ageism. Next slide, please. So that, of course, thinking about what we wanted to do led us to think about who do we need to reach, and to do that, we really spent time, and sort of the photo on the left reflects the number of sessions that we spent thinking, who do our audiences need to be, so like our colleagues in Maine, spent a lot of time thinking about who do we need to reach, who is that starting point, and we started with thinking about who is actually talking about aging and ageism. And the reason we say thinking beyond the usual suspects is we realize that unlike a lot of other subject areas, there are a lot of people that are talking about aging and ageism, and not all of them are necessarily within the aging ecosystem. We know that there are a lot of people who are contributing to the conversation in both positive and negative ways, and people who are contributing to negative and inaccurate stereotypes that interfere with our end game. So we really kind of did some mapping about who's talking about it, and then secondly, what are they saying? Who is advancing positive messages that could benefit from reframing and knowing how to put their message forward more effectively, and who are the people who are really contributing, or people in groups who are contributing to really advancing the negative stereotypes. Then we thought about where are they, and by where, not only do we mean geographically, because like Maine, Colorado is a big state that has, a combination of urban, suburban, rural, and in Colorado we talk about frontier, also tribal areas. So we meant geographically, but we also mean kind of communities of interest. And once we started thinking about communities of interest, where do the communities of interest already congregate in a way? So as opposed to asking people to come to us, where could we go so that we could start talking to people who are talking about aging? So those first three questions really led us to identifying those initial audiences that we wanted to reach. Then once we identified and mapped initial target audiences, we thought for each major group, why do they care about this, and or why will they care about this? And that led us to both develop kind of our outreach and messaging strategy to get them interested in the work we were doing. And then once we got to the actual kind of workshops and trainings on reframing aging, how do we customize those workshops so that we gain their interest? So again, a lot of similarities with our colleagues in Maine about making people understand how would they benefit from participating in this. Next slide, please. Next slide. Okay, thank you. So our key initiative elements, and I'm going to hold off on reframing aging for a moment because we'll talk about this for the rest of our presentation. But other elements that are core to our initiative outside of the reframing aging work are broader community education and organizing. So reaching out, for example, to members of the general public, to businesses, and specifically around areas of ageism and how older people can be really an asset to communities and to workforce. We recruited a group of initially 12 people called change agents. You see them there on the side, and they were recruited specifically because they had entrees into different networks that might not usually operate within the aging ecosystem. So we were really deliberate in thinking about what are different groups that are speaking in this space. And of the 12 people that we initially recruited, actually only 3 actually operate and have jobs in the aging ecosystem. Part of their role was to do work within their networks, so things like house parties, to appear and do presentations or events that are open to the general public. So, for example, our library system in May, Older America Month, does a series of events, so our change agents could go in and talk to people about ageism and why language is important, why positive views of aging are important to older adults themselves, and that was just an example. Another component of our initiative is really leveraging earned and social media, knowing that the way that we can amplify what we do is to make sure that the coverage of what we're doing extends beyond the people who are actually involved in it. So last year, we ended up, I think, with 12 stories, and I think one of the things that made us realize that we were, I think, hitting our targets in terms of diverse. I mean, we had anything from the local television station doing a story on the initiative to a podcast that's put out by people who like to cover controversial topics on ageism. And interestingly, they shared back with us that our podcast on ageism was one of the most controversial that they had done based on the comments that they received later in social media. So we also started in 2018 and are really ramping up in 2019 what we call targeted campaigns. So we've put together a business case for age-friendly and multi-generational workplaces. This is one of the things that grew organically from our work. So last year, I did, I think, 42 workshops and presentations. I've got this somewhere on a slide. And at every single presentation or workshop, people came up to us and said, that happened to me. I've experienced ageism. A partner has experienced ageism. My dad experienced it, that kind of thing. And so we realized that part of our campaigns is we needed to talk to people who are actually hiring and to businesses about why having multi-generational and older workers is actually valuable. So really ramping that up this year, and that's an example of our targeted campaigns. And finally, again, much like our colleagues in Maine, really thinking about who influences conversation, so doing a lot of mapping of that, not only as a target for workshops, but both Therese and I and our partners at Next 50 Initiative, having a lot of meetings individually with people who influence conversation about this, who are potential partners in getting the word out. So in whole, those are initiative elements, and again, happy to share more about that outside of this webinar. Next slide. So we know that you're here to hear about our work in reframing aging. So last year, again, 2018, 42 workshops and presentations reaching over 1,300 people in Colorado. And the components of our Reframing Aging workshop are this. So one, a series of trainings and workshops, and those could range from 1 to 1.5 hour presentations to influential audiences. So for example, trying to reach all of the major commissions and committees that work specifically on aging, leading them then to the more thorough workshops on actually using the reframing principles. And then we created and those were our 3-hour workshops. And then one of the things that we realized after doing a series of 3-hour workshops was that people kind of struggled with doing the actual kind of reframing. So we created and developed a curriculum for Reframe in a Day, where people can bring their collateral, they can bring their laptop with their website, and we literally walk through portions and help them kind of figure that all out. If you move to the right, we also did a mini grant. This was really geared to some of the smaller organizations that might not have large marketing budgets, but who were really interested in reframing. So the grants were up to $500. To be able to access them, they had to come to a Reframe in a Day workshop and basically present in an email a really short plan on, this is what I want to do to reframe. So maybe I need to pay our website designer to just change this page, or I'm going to pay for the reprinting of a brochure or that kind of thing. So it was help them support their cost. We awarded 5 of those in 2018, and I think we realized that that was a really effective strategy, and so we're going to go up to, I think 20, is it, Therese, in 2019. We also, in 2018, provided some technical assistance, so helping people with frame checks and providing some individual consulting. One of our big lessons from that in 2018 was that people were often asking us on the fly, so literally requests like, the mayor wants me to deliver a speech tomorrow, and I think that my speech isn't working really well, so could you reframe it overnight? And so we've kind of formalized a process now for doing frame checks and technical assistance, which is not to say that we won't do the emergency requests, but we'd like to do a few fewer of those. And finally, and this is probably one of the most important lessons from 2018, that the workshops themselves were really important and they are necessary, but they were not sufficient to help people actually be able to implement the work. So we've ended up spending a lot of time on developing tools and templates. And if any of you are familiar with Chip and Dan Heath's book called Switch, which is basically about organizational and community change, there's this concept of how do you shape the path? So you basically clear the obstacles out of the way. So a lot of our tools and template development was geared to help people remove the barriers to their actual implementation once they started trying to do the reframing work. So next slide, please. So we developed a lot of tools, but there were 3 kind of buckets of tools that I wanted to share with you that really helped people move from the reframing idea from the actual concepts and the ideas that are taught in the workshop and that exist on the FrameWorks website, from conceptual to actually being able to implement it in their organization. And the first are a series of what I'm calling reframing checklists, but people would come to the workshop and they would have a sense of, okay, so I know that I'm not supposed to use these words, or that I should be advancing this narrative about embracing the dynamic and confronting injustice. Some of those key social issue narratives that the FrameWorks training puts forward, and then would go back to their offices and go, okay, how do I actually do this? So we created a series of checklists, and we started using them in our actual training workshops so people could start thinking about what they needed to change actually in the workshop, but they could also take them back and share them with team members as they were, for example, looking together maybe at a flyer or a briefing or a website, so they would have a starting point. So that was kind of set of tools number 1. A second thing that occurred was people coming back, typically a few months later, very much related to the trial concept that Laura talked about, and they said, okay, so I left the workshop and I was so jazzed and I was so excited, and then my board of directors said, no, we're not going to do that, or my grant writer said, I don't know how to write a grant proposal if I'm not telling a sad senior story, or any of the kind of scenarios that might arise when people realize that this is a bit more complex than maybe they thought, or people saying we don't have time or money. So over a period of time, and we are continuing to develop this, we put together the scenarios that people expressed to us most frequently were barriers. And we actually now have embedded those into our workshop, that at the end of the workshop, we spend about half an hour to 45 minutes with people gathering into groups, and they practice scenarios. And it's based on the concept of implementation intentions for behavior change. You contemplate what barriers that you might face, and then you sort of practice, okay, when this situation comes up, what am I going to do? So that turned out to be, I think, a really helpful way of helping people kind of think through, what do we do next? And then a final set of things, and the grant writing toolkit is a really good example, that when people were actually practicing writing and using the frames, ran into some difficulty, and this came up again and again, and especially it seemed in making cases of support to funder, because people are used to telling, if you will, sad stories. And so we basically put together a set of grant writing toolkits that utilizes, embeds the frames for a series of types of work that organizations in aging do, from meals, delivery, home and community-based services, housing issues, and that kind of thing, so that people have things that they can look at and say, okay, these are examples. Next slide, please. So, like Maine, we've built in evaluation from the outset, certainly ongoing formative evaluation. A lot of our initiative, and we viewed our initial year, is based on kind of lean startup issues from the business sector. So lean startup with a lot of, dare I say this in front of Therese, fail fast and also then pivot. So the initiative itself and the activities we're doing continued to iterate. We had a really robust process evaluation. So we tracked literally everything that we did through both project management software and a series of online tracking tools that our evaluators developed. And our outcome evaluation wanted to look at to what extent are we moving the needle on those short, medium, and long-term outcomes that we delineated in our theory of change and logic models. So we did workshop surveys immediately post, follow-up 6 months after, and the analysis of that is currently underway. And our evaluators are also looking at secondary data collection and analysis. Next slide, please. So what we have right now, and I think we'll have in about a month or so, what we're finding from our 6-month follow-up, at least from the first 6 months of training that we did. But right now we do have the results of the surveys that took place of everybody who attended a workshop or presentation in 2018. So in terms of increased knowledge, which is one of our outcomes, 91% said that they had increased their knowledge of ageism, and 93% that they had increased understanding of effective messaging. Next slide, please. Really important to us was people's intentions after they participated in reframing. So 92% agreed or strongly agreed that they intend to use the reframe messaging. 90%, and again, we also were looking at diffusion, so 90% said that they would share frame messages with others, and 97% said that they will recommend the workshop. Next slide. And we wanted to leave you with this idea of the ripple effect. So very similar and aligned with the concept of diffusion of innovation that our friends in Maine used. Our idea was always that it would start with someone and it would start to ripple out. And we saw a lot of evidence that that actually did occur. We interestingly had champions who emerged from places that were way beyond what we initially considered the aging ecosystem, including someone from the
public library who totally embraced this and has now diffused it throughout the library. Policy nonprofits, even those not focused on aging, got on board and met with us and said we need to get this silver tsunami language out of it when we were talking about the Colorado state budget. We also, I really want to shout out both of our funders. They really used their network. So we're acted in a role that was so beyond merely funding, but really used their networks to amplify the impact of what we're doing. We also had a project advisory committee that basically had internal people, so from our funders, but also bridging with external people who had strong backgrounds in both policy, communications, organizing, social media, and they've really been able to help expand our impact as well. So next slide. Yeah, so if you want to contact us about any of this, definitely reach out. Therese and I are really excited to both hear from you and to learn from any of you. So would love to chat. And Therese, I know you have some ideas as well.
Yes, quickly, I just want to say that at the Grantmakers and Aging Conference, we did this session, and several funders and other groups said they wanted to come and experience our training in Colorado. So we plan to offer that either in June or September, and we'll be happy to share that information with GIA so they can share that with you and invite you to come to beautiful Colorado and go through Janine's training and some other fun exercises around this.
Okay.
Thank you.
So thank you. We look forward to your questions.
So thank you to all of our speakers this afternoon. We are now going to turn to some questions. And once again, if you'd like to type in your question in the question box that you find on the control panel, please do so at this point. So our first question is, both of you have worked on statewide models. Is this something that a local funder can do as well? And do you have any sense of what kind of scope makes sense if you're doing it just in a local region? So, folks in Maine, do you want to start with that one?
Sure. I would say that, yes, even though we are trying to, impact the sort of state as a whole, I would say in a way it kind of breaks down to some local and, regional efforts. So I think that definitely sort of this thinking about the sort of social system, I think, can be in any kind of size. And then kind of taking, looking at, your audiences within there and where you can have impact in in that local community.
And this is Janine. Yeah, this is Janine. I would just add that we initially started in Metro Denver, and it's because Next 50 Initiative came on that we ended up being statewide. And what is interesting to me is you can have an incredible impact in a local community, and the impact that you have in a local community is going to spread beyond that local community, whether or not you intended to. And the brief example I'll give is we did some workshops with some of the state government agencies and some of our local people that are working specifically, for example, on Medicare and Medicaid issues. And then I started getting calls from the Western Slope who said, a colleague of mine who is in Denver said, we need to be talking about that and that kind of thing. So I think you can absolutely have an impact in the local community, and if you are engaging kind of state level people, it is going to spread even if you don't want it to.
I'll add to that. This is Therese, and for Colorado, we have connected with our AARP colleagues because there's a network of age-friendly communities here across the state, and that has been a win-win partnership so that we can get into those communities. I think we've also had smaller funders. For example, the toolkit for grant seekers was a $5,000 grant from a local funder. So there are different little pieces that others can participate in. And again, there is that ripple effect.
Okay. Here's a substantive question, which is also probably the most difficult question around the reframing aging issues, which is many of the people that work in the aging sector work with the frailest and sometimes the poorest, sometimes folks who have very difficult health and social issues. Is this basically pushing them away? Is the question. So how do you make sure that in the process of having a more positive view of aging, we're not demeaning those who are in the greatest need?
So, John, this is Janine. I'm happy to take that because that question has come up in every single of the 42 workshops that I did last year, and so far in the 3 workshops I've already done this year. So it's really, really important. And there are a couple of things that I'll say that are part of kind of the frameworks research. So one, we know that advancing the frameworks, frames, and messages actually contributes to kind of a heightened public understanding and also builds support for some of the preventative kind of policy things that would delay, if you will, the onset of frailty. So that's kind of part one. Part two is, and I think some of your people in Maine, Laura and Ruta, have done this. There's also kind of another set of framing that FrameWorks Institute put together on, for example, elder abuse and on social supports that's really, really useful. And so we talk about that. And I think it's important to acknowledge and to talk about and to also give people access to those other frames. Because a lot of people, I think next week I'm speaking or presenting to, for example, the Colorado Attorney General's office, and those are primarily attorneys who are dealing, with elder abuse and some really horrific situations. So we're really going to focus on acknowledging that, yes, here are the positive things going on about aging, and we know that there are these other things going on, and FrameWorks has some really good resources on that.
Yeah, this is Laura. I would just add that yes, there's a separate toolkit and set of recommendations around elder abuse, and I would encourage you to go to FrameWorks website, and that's listed separately. And I know I think it's the National Center on Elder Abuse is certainly a resource for that. And I think that yes, some of those the values and the metaphors associated with that can be really helpful in talking about a more vulnerable population. And the other thing was, I just lost it. But yeah, okay, somebody else can jump in. I can't remember what I was going to say after that. But I think looking at those recommendations would be helpful. Oh, I know. And I think I think there's a tendency to think of even the recommendations around aging as sort of countering kind of prevailing negative views with sort of only positive ones, and I don't think that that's really what is intended. I think what's hard is it's not trying to go from only from very negative views to only positive, but to more of a balanced view. So seeing there are both sort of challenges and opportunities, and kind of going towards a more balanced view, not only a sort of positive, rosy picture that doesn't, sort of allow for the problems and challenges that we face.
I think we only have time for one more, and that is, where is the best place to go to look for the information that you've been talking about and the resources that FrameWorks Institute has to offer?
I believe they're available on their website. And John, I don't know, maybe GIA has been, I believe, helping to fund to make them available through their website. Are they still? I think there's quite a bit that is available directly from the FrameWorks website.
Right. So the FrameWorks website is FrameWorks Institute, all one word. So frameworksinstitute.org, and I've always found that if you just type in the word aging into the Google search that's internal to that document, that brings up the whole set of materials that we've been talking about. You can find all of them separately as well, but there's a tremendous amount of information there. It is a complex set of ideas, so It's not easy to have a kind of soundbite message on this, but there is a lot of stuff available. At this point, I'm going to turn to all of our speakers and ask for your final words of wisdom. And Ruta, I'll start with you.
I would just hearken to the ripple effect point that was made by our colleagues in Colorado, which is starting somewhere and having it grow is really the way that we will achieve large-scale impact, as opposed to trying to figure out how we do it all at once, focusing on the opportunities and building from there.
Laura?
Yes, I think that I would say, especially when talking to a general audience, I would encourage people to not necessarily start with trying to explain what reframing is, but to just go ahead and reframe.
Okay. Therese?
Well, I think I would say that culture change takes time. To not underestimate the ripple effect, to just get started. Also, what was just said about the language, and then also encourage people that want to get more information and resources to go to changingthenarrativeco.org, because there's a lot of resources on our website that, for example, there's facts on ageism, there's the brief on age-friendly and multi-generational workplaces, and just start. It's very exciting, and we're here for any questions as well, so I'm happy to help. Janine?
Yeah. So I want to echo a ripple effect, and I think where funders and others are in a unique opportunity, knowing your community. When you know your community, you know, if you will, who will make ripples, and so you kind of go to those. I think I can't underscore enough the idea of translating, helping people translate the concepts into some really concrete tools and templates, because at the end of the day, if we've sort of taught people how to reframe, then they don't know what they're going to do once they get back in the office. It stops. So really, the more kind of things that we can create and share broadly, I think the more likely that all of this is going to catch on, and that's what I'm really excited about.
And Therese, this is Therese. I have one more thing to say, actually, and that is changing the narrative really starts with ourselves, and we all need to be aware of how we're speaking and the language we're using, and that we need to be the champions within our own organizations to keep this on the radar screen.
Well, thank you all so much. I want to thank Ruta Kadonoff, Laura Lee, Therese Ellery, and Janine Vanderburg for all the work that you are doing to change the way people think about and act about the field of aging and the aging process. I also want to thank the Hartford Foundation for their support of this and our continuing series of webinars, and for making that available to our audience free of charge. We'll be making today's presentation available to anyone who wishes to view it later, including both the slides and the audio. Watch for an email to be sent to you within the next few days when that's prepared. We also hope that you will join us for our next webinar, which will take place on Tuesday, January 29th at 2 p.m. Eastern. The webinar is entitled PACE 2.0, Expanding the Reach of a Proven Integrated Care Model for Older Adults, and will showcase the efforts to expand access to PACE, which is, as many of you know, is the program for all-inclusive care for the elderly across the nation. Find out more on our website, giaging.org, giaging.org. And finally, I want to thank all of you for participating in today's webinar. Have a great day.